Hi, okay, I'm going to show you a few of the basic steps for self-lymphatic drainage. Lymphatic drainage it's really important that we always prepare this area of the body first. And the reason for that is that this is where the lymphatic system meets the circulatory system, which means the lymph empties into the blood. So you have to think about the lymph as being a little bit like rivers. So if you imagine a map, rivers won't be over the mountains. Rivers will be down in the valleys. And so where you can see the valleys on the skin is where you need to put your pressure. Now the pressure of the fingers is very, 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 very light. It's just fingertip pressure. And the feeling is that you're moving the skin. So you're doing this little press and a little half circle, and then you let go. And the best thing to do is if you can coordinate this with the breath, or you can even listen to a clock. So you can sort of think 1, 2, 3, 4, 5, release. 1, 2, 3, 4, 5, release. And you do that 15 times in each spot. So the first spot is here. Then you move out a little bit. And again, you're working down here into the creases. 1, 2, 3, 4, 5, release. 1, 2, 3, 4, 5, release. And then you come a little further out. 1, 2, 3, 4, 5, release. 1, 2, 3, 4, 5, release. So it's 15 at each spot. Now some people, depending on their arms, because of course after breast cancer surgery sometimes the arms can be weak, or the shoulders, some people are more comfortable crossing their hands. And when I do self-lymphatic drainage, I usually do it lying down with my hands crossed. So I'm doing this sort of inward movement like that, there, 15, and there. Okay. So those are really the first preparatory steps. And once you've done that, you can come just below the collarbone and you sort of try and put your tips of your fingers just into the spaces of the ribs. And now the pressure is like this. It's down and it's up. Down and then up towards your collarbone. So it's like pump, 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 and it's the same rhythm. Pump, pump. And it's still 15 at each position. And you might find, depending on the size of your hands, that you have 1, 2, 3 positions. So you're talking 45 movements here. 15, 15, 15. And all of that is just preparation, okay? Because once you've got it prepared, you can then start to find the little dip that's here at the front of the shoulder. And you can just stick your hands right on top of it. Now you'll see I'm crossing my hand over. I'm not going to be using the same hand from this side because that would be pokey. That would be too hard. And you just in, release, in, release, in, release, in, release. And that's 15 at this place as well. And once you've done all that prep, you can then start to do some flat hand pressures right on top of usually where the scar is found. So whether it's been a mastectomy or a partial mastectomy, usually the scar is about parallel with the armpit. And what I'm doing here is I'm pressing in, I'm maintaining the pressure slightly, and then I'm allowing a bounce back to push my hand away. And you'll notice again I'm still using the opposite hand. And if this is comfortable, after having done 15 here, you can go on top of the breast itself if the breast is still there. And again, it's just a pump in and release, in and release, in and release. And then you can go a little bit more lateral. So what you're doing is you're trying to work out in between the ribs, the spaces. And again, you don't want it to be pokey, but you want it to be a soft but consistent pressure. And it's again 15. And the rhythmic aspect of lymphatic drainage is extremely important. So if you have any difficulty keeping count or keeping a rhythm, do have a clicking clock. And you can count on your opposite hand if you really need to, 1, 2, 3, 4, 5 with your fingers, something like that, so that you don't lose track. And if you're able to do all that and you finish your little treatment, then you can always just do sweeping movements in and up, because ultimately what we want to do is we want to return the lymph back to here. But bear in mind that if there's a scar here, whether the scar is small or big, you're not going to be able to move the lymph over the scar. So any lymph that's accumulated that's below the scar is not going to move upwards, it's going to move downwards. And so the only sweeping movement that's going to be effective is going to be a downward sweeping movement, because then you would say orient yourself of the height of the scar and sweep up and in. Okay? And all lymphatic drainage is made more effective by deep breathing. So if you can coordinate deep breathing, whether it's in and out through your nose or in through your nose and out through your mouth, whatever you can do in terms of breath will benefit your treatment, because the lymphatic system is pumped by the breath, by the movement of the lungs and the pressure difference that's created by the movement of the diaphragm. So that's the best description that I can give. I hope that it's of help. Bless you.